Hello everyone. Today I'm going to show you my 20th notebook and how I created it. When I was revising, I would come across certain things that would appear important to me at the same time confusing or volatile. I used to note it down in a page or at the end of the notebook itself. And later, when I have completed that subject, I would make flashcards out of it. When I had a handful of flashcards from different subjects, I organized them subject wise. And here I have a digital version of it. And this is the line or hard copy. You can see flashcards sticked onto pages, followed by pages where each page denotes a particular subject. And here we first year with anatomy, biochemistry, and physiology. The second year, the third year, this is for PSM, then ENT and Ophthalm, medicine. What would happen when you have things sequentially is you would remember which page to go to when you want to quickly see a specific thing. Then surgery, I have more than a couple of pages denoted to surgery, the gradings, the stagings, classifications. Here's pediatrics, minor subjects, then anatomy. This page, everything on it is for anatomy. And suppose I come across a new information that I need to add, I could add it in this space here. Physiology, biochemistry, and second year subjects are in general slightly difficult to remember. So even when you have understood the concepts, you still need to look at them very often. The enzymes and the vitamins, the rate limiting steps. There are many things in this book that I did not find as it is. I had to use a couple of resources, use my own creativity, and arrange them in a way that it would be very pleasing for me to revise. There are flowcharts, and for example, here every storage disorder that is required for me to know, I have it in this one page or two sides of one page. Pathology, the CV markers, the differences in clotting factors, and moving on to Carmack, again receptors and different drugs, agonists and antagonists, microbiology, all those little organisms and their tests, appearance, virus and their classification, enveloped or not, selective medium with their appearance, bacteriology. And this is something that I'm proud of that is when I compiled helminthology. I used to dread this topic in particular because everything felt the same, and when I would have difficulty, I would often confuse them. But here we have it, cystodes, trematodes, and the nematodes, intestinal and tissue ones, all together in just 2 pages. Forensic medicine, different age of ossification, changes in fetus, the rule to determine the ages for the length, the test, initiate a light born or a stillborn, PSM. This was also very confusing to me. Um, whether that which vector and what is its common name, I would mix it up. Let me know if the same happens with you. And the drugs as well, because these are not the drugs you hear very commonly of. The formula of PSM, and then I put in every other subject formula here, ENT, ophthalm, medicine, and with medicine I also combined the drugs used in medicine and allied subjects like ophthalmpedia. This is what is. And here are some flashcards that didn't, didn't felt very important to go right at the beginning, but were still important. Yeah, all the drugs, the newer advancements, the monoclonal antibodies, surgery, surgery. I have classification, the drugs, and then staging, OBGY, in which sexual disorder, what development occurs, what is left behind, the staging of cervix, extremely important. Then I also put in uterine, vulval, and ovarian cancer. Ovarian, I just felt like I only need to remember this much. The menstrual hormones and the liver timings and stages, what disease would occur if the time limit is crossed, and what should be the management. So stage wise, pretty concise. The reflexes, then pediatric milestones. You don't have to remember paragraphs of milestones at every age, but you can definitely, just remember the keywords or the key thing which is mentioned. Often it is the blocks when it comes to fine motor milestones. Then we have the short subjects here: radiology, orthopedic, dermatology, anesthesia, genetics, and the chromosome numbers and the related disorders. So this is pretty extensive, and I really did not think that anything outside of this will be asked. Some miscellaneous things that didn't fit anywhere but yet felt important, like what other diseases caused by smoking and what is smoking protective for. The H. pylori, same things for H. pylori. This is 20th Notebook Part 2. It's very short because it only came into existence, say, a week before the exams when I didn't feel like I should write all of these down and just a digital version would do. Certain IPC and the new BNS, certain things from microbiology, couple of images that I felt were, good to go as it is. And here it ends. I really hope that this would give you an idea into how you can create one of your own. I would like to know if you have more ideas about this. Even in my video, I've mentioned that you can also put certain of this content into Anki, which is an app where you can create flashcards to revise things daily. And I hope that this video helped you learn something. Thank you.